Anger over massive cuts to the state's health budget has reached a new level. A survey released to 7:30 Tasmania reveals 40 senior doctors at the Royal Hobart Hospital have considered leaving. As Tamara Glumac reports, there's also concern the state government is at risk of legal action over delayed diagnosis and treatment.
As savage cuts to the state's health budget start to bite, the public outcry is growing.
No more cuts!
In the past few weeks, hundreds have taken to the streets across the state to protest. Health unions are warning the cuts will have deadly consequences.
It's a big call to say that there will be blood on this government's hands, but I think that based on what this government's doing, that will in fact happen.
Behind the walls of the Royal Hobart Hospital, in theatres, wards and consulting rooms, there's another level of concern that's been hidden. It's the fears of more than 100 of the state's top doctors. They've taken part in a confidential survey released to 7:30 Tasmania by the Medical Staff Association. The survey found more than 40% of respondents, most of them specialist doctors, have seriously considered withdrawing their services because of the budget cuts.
The hospital relies on senior doctors for the supervision of young doctors, for the delivery of services, the training of young doctors and the training of medical students. So all of those areas will be impacted.
80% of respondents describe the health crisis as the worst they've experienced, and nearly 70% feel they've had no input in finding solutions.
Many doctors expressed that they didn't feel that their concerns and the risks that they are able to identify had been adequately addressed.
One staff specialist described a culture of fear and disengagement at the Royal Hobart. A senior consultant said he's never felt more like a foot soldier. Another survey respondent expressed a fear that worsening workplace conditions would drive specialists out of the state.
Patients will get a poorer deal. They'll be left with often painful and disabling conditions for much longer than is necessary, and there are some conditions obviously that can lead to death untreated.
Health cuts dominated question time in state parliament this week as the extent of cuts emerged.
And can the Minister further advise exactly how many beds in total will be closing at the Royal as a result of your cruel and heartless and savage cuts?
We are looking at better capacity to flex beds up and down. We're probably looking at around 28 beds at the moment.
This week, staff at the Royal were told 75 full-time jobs, most of them nurses, will go. More than 1,300 elective surgeries a year will be cancelled, and the hospital still has to find $30 million in savings by June. In the state's north, the Launceston General Hospital has to cut more than $100 million over the next 3 years. 2 operating theatres will be shut, 44 beds closed, and senior sources within the hospital say about 100 nurses will lose their jobs. In Burnie, the Northwest Regional is shutting 16 surgical beds.
It's at the brink of a cliff and we're starting to fall, and I think it's going to be plunged into a crisis the like of which I've never seen before, and our healthcare has got the potential to move to a second world, third world sort of status.
Professor Scott Parks, an intensive care specialist at the LGH, says the Commonwealth must intervene. He's just written a third letter to the Federal Health Minister Nicola Roxon.
We've had one response from her which I have to say was very formulaic and really just detailed the amount of money that's been spent. It failed to recognise the problems and it certainly failed to provide any solutions for them.
At the LGH, more than 600 people are already waiting for endoscopies, a procedure which helps detect diseases like cancer. That waiting list is expected to blow out, with cuts to day surgery procedures also likely.
increasingly what we're finding is that because people are waiting so long for diagnostic procedures, that by the time we diagnose their cancer, it has actually progressed beyond the point where it is curable.
Dr Rob Walters is a medico-legal advisor for the Medical Indemnity Protection Society.
We've had a number of telephone calls from very worried doctors about the fact that they've got less ability now to get patients who have urgent need into these clinics to have endoscopy and colonoscopies done in a timely fashion. They're worried that the patients are going to have cancers that are spreading whilst they wait to have them diagnosed.
Dr Walters has warned the state government could face legal action if lives are lost because of budget cuts.
There's already been legal action in delayed diagnosis being made, and if there's further delays in the diagnosis being made, then clearly that means there's a greater chance of significant legal action. What we don't want to see is our members, our doctors, being joined to that legal action, even though they've attempted to get that procedure done expediently.
The Health and Community Services Union believes the state government should wear the costs.
There's no doubt that if there is a negative outcome as a result of a patient being denied services, that it would be reasonable for them to pursue this government.
And it seems there's more at stake for the government.
What we're seeing right now has never been seen before in Tasmania's health system. Every day there are people who have stories about the effect of these cuts on themselves, their own lives and on their families. The reality is that this is a slow burn for this government, and it will be a slow burn up until the next election unless they change their approach to these cuts.
Already, Tasmania has some of the nation's worst health outcomes and highest death rates. With millions of dollars being cut from a system meant to heal people, the future looks grim.
7:30 Tasmania had hoped to speak to Jane Holden, the acting head of the Royal Hobart Hospital today, to discuss the doctor's concerns. She would not make herself available for an interview prior to going on leave.